worked in a nursing home for about 7 years and dealt with every kind of patient you can think of. Some of the patients that you remember most are the ones who act out not knowing what they're doing, the ones who tell you their name is something different every day, or the ones who don't even know who you or their family members are. Alzheimer's disease is one of the most common diseases that you see in nursing facilities. Each patient with it is unique in their own way. Working with patients day in and day out, it is important for us to learn about Alzheimer's. We all know the common forgetfulness that it is associated with, but I want to dig down deeper and let you look and understand other aspects of it. Most of us, if not all, will one day have to take care of someone elder, or at least be in their life. When someone who is near to your heart develops Alzheimer's disease, I want you to be able to understand what they are going through. I want you to be able to identify the early onset, and hopefully if someone you know is exhibiting these factors, you can act fast to get them help. As our population ages, the percentage of Alzheimer's increases. Although every case is somewhat different, there is commonality in all cases. I will guide you through this in order to help you understand Alzheimer's more. Let's start off with Alzheimer's, what Alzheimer's is and how it affects the person. Alzheimer's is estimated to affect 5.1 million Americans. Alzheimer's is a progressive degenerative disease that attacks the brain's nerve cells, resulting in memory loss, thinking or language skills, and or behavioral changes. If you look at this picture here, it shows an MRI picture of how the normal brain looks, a brain with mild cognitive impairment, and a brain with Alzheimer's disease. According to the Alzheimer's Foundation of America website, Alzheimer's is the most common cause of dementia or loss of intellectual function among people aged 65 or older. Alzheimer's is not a normal part of aging. Although every case is different, the warning signs are very common. The warning signs include memory loss, especially of recent events, names, placement of objects, or other new information. Confusion about time and place, struggling to complete familiar tasks such as brushing their teeth, trouble finding the appropriate words, completing sentences, or following directions, poor judgment when making decisions, changes in mood and personality, difficulty with complex mental assignments like balancing a checkbook. Symptoms are divided into two categories, and treatments vary. Cognitive and intellectual symptoms include aphasia, which is the inability to communicate effectively, amnesia, which is loss of memory or inability to remember facts or events, apraxia, which is inability to perform activities of daily living, agnosia, which is inability to interpret signals from the 5 body senses. Psychiatric symptoms include personality changes, depression, hallucinations, and delusions. Current treatments are unlikely to delay, prevent, or actually cure the disease. There are 4 approved medications on the market now to help maintain mental function. These medications include Aricept, Exelon, Razidine, and Namenda. Research is still underway on how to control behavioral symptoms, but if we are able to find a way to control these, it will be easier for the patients to cope with Alzheimer's and also for the caretakers. Although I cannot give you every detail on Alzheimer's because each case varies, I hope by this you have learned more about how it affects the person and some treatment options as well. I bet if you think about it, you probably have known someone in your lifetime that was affected by the disease. Whether it is mild, severe, or moderate, it still takes a toll on us as caregivers and family members. No one wants to have their loved one go through this, but with fast developing researches, our chances of fighting the disease are getting stronger. Alzheimer's is a hard disease. Life expectancy varies anywhere from 3 to 20 years after being diagnosed. In the end stages of Alzheimer's, a person usually becomes totally disabled. Research is advancing in the near future, and hopefully we can prevent this from happening.